Good afternoon. We're gathered on Treaty 6 territory, and I want to acknowledge the Métis people of Alberta who share a deep connection with this land. The news conference we saw a little earlier today shows just how out of touch with real Albertans Danielle Smith really is. I didn't see a single frontline healthcare professional at the government's press conference, but I did see Danielle Smith say, and I quote, "AHS is not in crisis." This is simply a lie. Today, on AHS's website, you can see 32 partially closed hospitals due to staffing shortages. Today, expectant mothers in rural Alberta are being forced to drive for hours in labor to give birth in a different town. Today, the UCP still isn't even meeting their own targets for surgical capacity, despite shoveling taxpayers' money into private profit margins. What progress they are claiming in emergency rooms is largely due to the seasonal retreat of respiratory illnesses. The truth is, the UCP has starved and attacked our healthcare system in Alberta for almost 4 years. The UCP tore up contracts with doctors, threatened to cut wages, harassed individual health workers online and in person, and denied the science of vaccination. So many healthcare professionals felt they had no choice but to leave Alberta, change careers, or retire. The impact of the chaos caused by the UCP has resulted in dozens of rural hospitals partially closed, urban emergency rooms overwhelmed, ambulances delayed longer and longer, and whole cities where they can't get a family doctor. Albertans cannot trust the UCP government with health care. Before I take your questions, I'll comment briefly on the health funding deal with Ottawa offered and Danielle Smith accepted. But put simply, it's inadequate. The dollar figures barely catch up with the cuts the UCP, led by Danielle Smith, has inflicted on Albertans' care over the past 3 years and a half. There is broad consensus the federal offer is too small, but Danielle Smith took it anyway. Both orders of government are failing Albertans. The federal government isn't bringing enough to the table, and Danielle Smith is focused on preparing Albertans to pay out of pocket for their health care. The Alberta NDP has a real plan ready to go now should we form government in May. On February 15th, our leader, Rachel Notley, announced the Alberta NDP's Family Health Team strategy that will connect 1 million more Albertans to a family doctor and a family health team. And you will never have to pay to see your family doctor. Our vision for building and strengthening family health care in the province has the support of health professionals, including Dr. Rick Spooner, former chair of family medicine at the University of Alberta. Dr. Spooner said last week that of all the documents he has read on the subject of primary care, this one most palpably gets to the heart of the matter and offers practical solutions. A family health clinic will give all Albertans immediate access to a range of primary care professionals who can help them respond to a problem, manage a chronic condition, and generally support Albertans in maintaining good physical and mental health. An Alberta NDP government will move quickly to hire 1,500 non-physician team members to join existing clinics while work proceeds to open 10 family health clinics across the province. Thank you, and now I'm happy to take your questions.
Thank you. Just a reminder, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. We'll go to our first caller. Your line is open. Hi, Sarah, your line is open.
Hello?
Yes, we can hear you.
Okay. So when it comes to the dollar amount that is in that agreement between the feds and the province, why is that inadequate? Like, how much aid do you think would be appropriate in this?
Yeah, well, really what we've gotten is the status quo. And we don't need the status quo, we need transformational change. And certainly I know and believe that Rachel Notley and an NDP government would fight for Albertans and make sure we get that, because we're not getting that from either our Premier or the federal government at the moment.
Do you have a follow-up, Sarah?
Yes, I do. When it comes to as well the numbers that the province has put forward, they're saying that there is also the wait times with ambulances have decreased, and they are working on providing supports in rural communities. And there are numbers that they have that do support this. I mean, it does seem like a positive move in the right direction, but like how do you think that could be taken further?
Well, exactly. Public health care must be there for all Albertans. And you know, every day I look in my inbox and I hear stories from Albertans. Recently we spoke to the daughter of a 92-year-old woman who was denied ambulance, and she was frail, she was not well, she was dehydrated, and she was rerouted to 811. We know stories in Fort Saskatchewan where moms can't deliver their babies in the local hospital and must drive for hours in labor to go there. We know that 40,000 people from Lethbridge don't have a family doctor. I mean, we're in crisis still. There's still so much more to be done, and it's just not being done under the UCP government, and we really can't trust them to take care of our healthcare system.
Thank you, Sarah. We'll go to our next caller. Catherine, your line is open. Hi, Catherine. Your line should be open now. Catherine, do you want to try again? We've got your line open, we hope.
Oh, hi, sorry, can you hear me now?
Yes, yes, thank you, Catherine.
Sorry, I got kicked off somehow. I just wanted some clarification. When you say this deal was inadequate and yet the Premier accepted it, are you suggesting that she should not have accepted this agreement and should have held out for more funding or a better deal, or what were you saying there?
Yeah, well, I think that, yeah, she didn't negotiate a good enough deal for Alberta, and I believe that I know that Rachel Notley would have been a champion for Albertans. So she accepted something that was inadequate, and you know, we just really can't trust the UCP to protect our health system in Alberta.
Do you have a follow-up?
Yeah, on the federal side of things, do you think that the federal government put enough strings attached to this money?
Well, I mean, I think it's important that, you know, healthcare dollars be focused on healthcare. So, you know, I certainly am a supporter of, you know, the federal government making sure that our public healthcare system is invested with the federal dollars. So I would say that that is an important thing.
Thank you. We'll do one more pass for calls. Just a reminder, or question, sorry, if you're on Zoom, it's the raise hand function. If you're on the phone, it's *9. Seeing none, that ends the press conference for today. Thank you.
Much for watching, and to learn more, check out albertasfuture.ca.